Let us understand the types of IV fluids, their indications and contraindications. IV fluids are divided into crystalloids, colloids, blood and blood products. If we talk about crystalloids, the crystalloids are the salt solutions, for example, normal saline or RL. Colloids are high molecular weight substances which maintain intravascular volume. Crystalloid solution can be isotonic, hypotonic or hypertonic. Isotonic means they will have same osmotic pressure as of plasma. Hypotonic solution means they will have less concentration of solutes, more of water. So fluid will shift from high concentration to low concentration. So fluid will shift from vessels to cells. Hypertonic solution will have more concentration of solutes and less of water as compared to plasma. So fluid will shift from cells to vessels. Let us talk about the types of IV fluids. First, 5% dextrose, best fluid to correct intracellular dehydration. The rapid infusion can lead to risk of glycosuria. Indications of using 5% dextrose are dehydration, ketosis, pre and post surgical procedures, IV administration of certain drugs. Major contraindication is cerebral edema. 5% dextrose is more like hypotonic solution, so fluid will shift from vessels to cells. So it can further damage or aggravate edema. So it is contraindicated in cerebral edema or in increased intracranial tension, or it is also contraindicated with blood transfusion. Next contraindication is of course diabetes, as it contains dextrose. Next we have is 0.9% NaCl or isotonic saline or normal saline. Indication to use NS is hypovolemic shock, diarrhea or vomiting. In vomiting we use NS, and in diarrhea we prefer to use RL. And also used in brain edema. It can also used as a vehicle of certain drugs. Contraindications are hypertensive patients, edema due to renal, cardiac or hepatic causes or their dysfunction. Also contraindicated in metabolic acidosis. Next we have dextrose 5% with half normal saline. It is mainly used as a maintenance solution, or it is also used as a pediatric solution. It is used when we need more of water and less of electrolytes. It's contraindicated in conditions where we require more of salts, like in vomiting or diarrhea. Next is DNS, dextrose normal saline. It contains 5% dextrose and 0.9% NaCl. It has energy and salt as well. Unlike 5% dextrose, it is compatible with blood transfusion. As it is hypertonic saline, it will not cause hemolysis. One thing, rapid infusion of DNS in hypovolemia can cause osmotic diuresis even if patient is in fluid deficit. This is so because the sugar molecule is excreting out, and along with sugar, the water will also excrete out. So it will lead to osmotic diuresis even in hypovolemia cases. Now if we talk about RL, it is also called as physiological fluid because it contains same electrolytes as that of plasma. It is good for hypovolemic shock. It can be used in diabetes mellitus. It can be used in metabolic acidosis as it contains lactate, and lactate will convert into bicarbonate in liver. Uses of RL. RL can be used in burn cases or in metabolic acidosis or diarrhea-induced dehydration because RL contains lactate, and this lactate will convert into bicarbonate in liver, and in diarrhea we have major loss of bicarbonate ion, so it will replenish the bicarbonate stores. So it is contraindicated in liver dysfunction as the lactate will not convert into bicarbonate ions. It is also contraindicated in blood transfusion as it contains calcium, which gets combined with citrate, which acts as anticoagulant in blood transfusion. So it will inactivate the anticoagulant. Now if we talk about the best solution, then we have balanced electrolyte solution or plasmalite. We have isolite G. G is gastric replacement solution. It can replenish the electrolytes which are lost in gastric fluid, for example in vomiting or nasogastric aspiration. Next we have isolite P. Isolite P is pediatric solution. It contains more of sodium and less of potassium, so we have to be little cautious about renal insufficiency. It can also be used in adults in severe water loss conditions. Next we have isolite M. Isolite M is maintenance fluid. It also has more of potassium, so be cautious in renal insufficiency. It corrects acidosis and supplies energy. We have isolite E, that is extracellular replacement solution. Electrolytes are same as ECF but double concentration of potassium and acetate. It is the only IV fluid to have magnesium. As it contains acetate, so it converts into bicarbonate and hence it will correct acidosis, and it is only fluid to correct magnesium deficiency.